Friends, welcome to Smile Nursing tutorial. Last time we have discussed about PPIUCD, postpartum intrauterine contraceptive devices. Now today we are going to discuss about the family planning. In this family planning we are going to see one method, that is LAM. What does it mean? Lactational amenorrhea method. This method women can be used as a natural method and as a lactational amenorrheal method. When she decided to use this method, she has to keep 3 points in her mind. Before going to see 3 points, first we'll see the family planning slogan: bear fewer children and plant more trees. The following 3 points: one is amenorrhea, second lactation, third 6 months. Now we are going to speak about amenorrhea. In this amenorrhea, the woman should be amenorrheic and her menstrual cycle should not have resumed after delivery. Whenever she resumes, she can't use this amenorrheal method. Coming to the lactation method, the woman should be given exclusive breastfeeding for her baby. The baby should be given no complementary foods or fluids. She should be feeding 8 times or more during the day with minimum gap of 2 to 3 hours between the feeds. Even night feed should be given at least once. Single missed feed can increase the risk of pregnancy. Coming to the 6 months, the woman cannot be used this method for more than 6 months if she has not started menstruation. Today we have discussed about the lactational amenorrheal method. In this method, 3 key points we have seen. Thank you for watching this video. If you like, share, subscribe and comments. Keep watching my channel for new updates.